Okay, so I showed you the Golgi tendon organ release on the Achilles tendon, but I neglected to show you one other finger placement that works really well, and that's the pincer grasp. So you can come in and find the musculotendinous junction and actually do a pincer grasp like this, and then bow the tendon like this, and this is creating an S curve. And then we would hold for at least 30 to 60 seconds or longer until the muscle releases. And I've held some Golgi tendon organ releases for 2, 3, 4 minutes before. And I know other therapists have held them for even longer, trying to create a really strong response from the motor neurons. So that pincer grasp is another great way to treat the Achilles tendon. I'm going to now show you the same technique on a couple of other muscles. As you know from the lecture, Golgi tendon organ treatments are best used on muscles that have long tendons. So a few of the long tendons that are easily treatable, they have to be kind of more superficial, but you can treat long tendons like the tendons of the hamstrings. So you can treat the hamstring distal tendons, medial and lateral, and you can also treat the common hamstring tendon at the ischial tuberosity. So I'm going to show you first the distal tendon, and then I'll show you how to do the proximal tendon. So first thing you have to find the actual tendon, the hamstring tendons. So as you know, the best way to locate a muscle, to palpate it, is to go into that area and then get the person to resist the action. That will cause the muscle to contract, and then it will pop up into your hands. So here I am, I'm on the medial side here, looking for semimembranosus and semitendinosus, and I think I'm in the right area. So what I'm gonna ask Paige to do, I'm gonna put my hand down at her Achilles here, and Paige, can you just press up into my hand here? So she presses up into my hand, which creates a contraction of the hamstrings, and immediately I feel the tendon right here. And you may have to play around with this. This is getting more specific with your palpation, so don't get frustrated if you can't feel it immediately. Play around with it, try it on a few different body types, a few different people, try it on yourself, palpate the hamstring tendons yourself on your own body, and you'll get more familiar with this palpation. So now I've found her tendons here. I would almost use another pillow to put the tendons on more of a slack so that I'm able to do this technique a little bit better. So I'm putting my knee here, but you wouldn't do this in a clinical situation. You'd put a pillow there. So I've got the tendon here. So now I'm going to employ my C or S curve. So I can feel this tendon here. So I'm going to put my thumb on one side, and I press my thumb into the other side, and I get her to take a nice deep breath in. And on an exhale, I'm going to distend the tendon. So I am not sliding on the skin at all. I am tacked down way beyond the skin and superficial epidermal layers and superficial fascia. I am tacked down into her hamstring muscles. And that is really crucial. If you were on the skin and doing a distension technique like this, it's going to feel really awful and pinchy for the person. So if you get that feedback and they say, oh, it just feels pinchy, then it's probably that you haven't sunk in deeply enough, and you just need to take your time. There's no quick way about this. Let your fingers sink in, take some breaths with your client, and allow your fingers to get into the deeper layers. So again, 30 to 60 seconds, 2 pounds of pressure approximately, or until the muscle releases. And then when it does release, we relax. And voila. And this is really great because the hamstrings are one of those large muscle groups that gets inflamed and gets tight, and it's not unusual to see somebody have a contusion or a laceration or some kind of injury to the hamstring. If the muscle belly was affected, then you can use these techniques to create lengthening of the muscle by only treating the tendon. So they're a very, very useful technique. Okay.